All right, today we are diving deep and hacking into the brain's most powerful reward and motivation circuit. We're going to look at how three totally different substances, a breakthrough medicine, a really common stimulant, and a notorious street drug, all manage to target the exact same master switch, the dopamine system.
So let me ask you this. What in the world could possibly connect a therapy that gives Parkinson's patients their movement back, a medication that helps people focus, and one of the most infamous party drugs out there? Well, the one-word answer is dopamine. But how they each mess with it is this incredible story of, ingenuity, brute force, and some serious biological trickery. Okay, so first things first. Before we can really get into the hacks, we've got to understand the system we're trying to hack. And the absolute heart of this story is one of the brain's most famous chemicals, dopamine. To put it simply, dopamine is one of the most important messengers in your brain. It's pretty much the engine that drives your motivation, that feeling of reward you get when you accomplish something, and, this is really critical for our story, it's absolutely essential for smooth, controlled movement. Now, here is the big problem. If someone has low dopamine levels, like a patient with Parkinson's disease, why can't we just, give them a dopamine pill? Well, it's because the brain has this incredible fortress protecting it called the blood-brain barrier. And dopamine itself, it just can't get past the guards. So, if you want to influence dopamine levels, you have to get crafty. You've got to find a hack to get around that barrier. And that is exactly what our three substances do, each with its own unique, and you could say brilliant or dangerous, strategy. Let's break down how they each pull it off. You can really see the three totally different playbooks right here. Levodopa, that's the elegant workaround. It sends in a disguise, a precursor. Cocaine is more like a saboteur. It just jams up the brain's cleanup machinery so dopamine sticks around way longer. And amphetamine? That's just pure brute force. It kicks down the door and forces all the dopamine out. So 3 drugs, 3 completely different ways of getting the job done. Levodopa's strategy is what's called a prodrug. Think of it like this. The brain's security won't let a finished cake, that's our dopamine, through the gates. But it will let the raw ingredients, in this case levodopa, pass right on through. All the baking then happens on the other side, inside the brain itself. It's pretty genius. And this is how that slick process actually works. First, levodopa basically hitches a ride on a special transporter to get across the barrier. Once it's inside, an enzyme gets to work, transforming it into the dopamine the brain so desperately needs. And the result? Motor control is restored for patients. It really is a clever, elegant therapeutic hack. Now, let's look at the 2 stimulants because they are a whole different story. Imagine your nerve cells use a tiny little vacuum cleaner to suck up leftover dopamine. Well, cocaine just jams